So, it hurts when you pee and you don't know why or what to do about it. Well, I think I can help. Let's talk about the 3 most common causes of urinary pain. First, let's start with some anatomy to really get an idea of what's going on in there. These are your kidneys, the bean-shaped organs that filter the liquid waste out of your blood, producing urine. The urine is then drained through your ureters to your bladder, where the urine is stored until the bladder is full. And when it's time to pee, the urine pours out of the bladder through the urethra, exiting the body and hopefully ending up in the toilet. A closer look at the kidneys shows us the cortex, where the blood travels within the kidneys, the medulla, where the blood is filtered and urine is produced, and as the urine builds up, it starts dripping into these spiky little cup areas called calyces, which then funnel the urine into the ureter to be delivered to the bladder. The urinary system is usually pretty good at keeping itself clean and in working order. Constantly making and passing urine keeps the bacteria flushed out and doesn't give them a chance to grow into an infection. However, sometimes things go wrong and an infection gets started anyways. Like in a bladder infection. Sometimes the bacteria that live on our bodies are able to travel up the urethra and attach themselves to the bladder wall, where they then multiply and grow into big enough numbers to cause an infection. An interesting anatomy fact is that females have much shorter urethras than males do. Basically, a shorter distance for the bacteria to travel to get into the bladder, which is a big reason why women have more urinary tract infections than men do. Bladder infections usually cause pain with peeing, can make you need to pee more often, can give you lower stomach pain, like tenderness over where the bladder is, and fever. These basic urinary tract infections, also called UTIs, can go away on their own, and it helps if you drink lots of water and cranberry juice so that you pee more and flush the bacteria away. And you can take aspirin and Tylenol for the pain. But if you think you might have a UTI, it may be best to go ahead and go to the doctor for antibiotics, especially if you have a fever. Bladder infections may not seem too bad, they're mostly uncomfortable, but bladder infections can easily spread and cause more problems the longer they're left untreated. For example, bladder infections can easily spread to the kidneys and cause a kidney infection. Kidney infections are called complicated UTIs because they are almost always a complication of a bladder infection that was left untreated for too long. They're also more serious and harder to treat. Kidney infections usually have all the same problems as bladder infections. Pain with peeing more often, plus higher fevers, lower back pain on one or both sides, that's tenderness around where your kidneys live, and you may even have blood in your urine. Kidney infections are serious. The kidneys are important to keeping our blood clean, and infections directly damage the kidneys. So the longer the infection is untreated, the more long-term damage can be done. Also, because the kidneys are in such close contact with the blood, the bacteria in the kidney can easily spread to infect the blood, and the blood will spread the infection all over the body. Big bad. Because of this, you should go to your doctor for antibiotics for bladder infections that don't get better on their own after a couple of days, because you want to minimize the chance of the infection spreading to the kidneys. And it's important to go to your doctor immediately if you start having symptoms of a kidney infection. These need to be treated with antibiotics and treated fast. So, bladder infections and kidney infections are both infections of the urinary tract, UTIs. But what if I told you could have urinary symptoms not caused by a UTI? There are some tricky infections that can cause pain with peeing, make you pee more often, and cause lower stomach pain, but they aren't UTIs. Sexually transmitted infections, STIs, can present like UTIs. They're an infection of the reproductive tract, not the urinary tract, but because the two tracts live so close together, they can cause similar symptoms. We won't go into too much detail about STIs here, they'll have their own video, but I wanted to give you a heads up. If you're sexually active and have been having urinary symptoms, especially if you're also having genital discharge, itching, or noticed a bad smell, then you should go to your doctor and request STI testing. With testing, STIs are easy to find and easy to treat, so be safe, get tested. So that's that, the 3 most common causes of urinary pain and what you can do about them. I hope this video helped, and I hope you get to feeling better soon. This is Dr. Says, encouraging you to live happy, healthy, and bold. Bye!